Welcome, 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 my Be Health Empowered family. It is truly a beautiful day. We are back together again here on Excuse Me, Doctor, where we bring you the evidence and the information that you need to make wise health decisions, not just for yourself, but for your family and for your community. My name is Dr. Melissa Clark. Please call me Dr. Mel. Welcome to my newbies who might be joining us for the first time. If you've not, been with us before, know that we are here to also answer your questions, hear your concerns. So please go ahead and make sure that you hit like if you're checking us out on Facebook, and subscribe if you're checking us out on YouTube. And please make sure that as the show goes on and, we get into it and we're hitting all the topics that are just going to make this an amazing week for everybody. As we're doing that, please remember to put your comments in the chat, and especially your questions in the chat. We want to hear from you. Now, there are two other people that we want to hear from, and they are my incredible co-hosts, Mr. Wayne Bruce and Miss Lila Mays. Come on through. How y'all doing?
How you doing?
Hi.
How you doing, Dr. Mel?
Happy Monday.
Happy Monday. We starting the week off right.
Monday.
So what's going on?
Oh my goodness, there's so much going on. So much going on with this new administration, and the last few days, the last week even, healthcare and public health has been all up in the news.
I mean, from vaccine skepticism,
from vaccine, yes.
Measles epidemics.
Yep.
I mean, Medicaid, healthcare funding rollbacks, all the top TikTokers pushing craziness, miracle cures. It's chaos out there, Dr. Mel. It's chaos.
It is chaos,
It
exactly.
is.
And it's not just social media. It's not just social media nonsense. These are real policies shaping the health of our communities. The vaccine skepticism and misinformation is coming from the people who are supposed to be safeguarding us. So where does that leave us, Dr. Mel?
Well, that is the big question. Are we headed towards a public health crisis, which is the title of the show today, or are we already in one, right?
Right.
So we're gonna talk about that.
What can we do about it? I mean,
Yeah.
What can we do about it? Who's leading the fight for evidence-based health policies? I mean, who's standing up for the public's health in the face of misinformation, political interference, and funding cuts? Who's doing that?
Right. It's a lot. Well, we are fortunate because we have one of the most prominent voices in public health with us tonight. His name is Dr. Georges Benjamin, and he's the executive director of the American Public Health Association. It's all up in the name. That is what he is all about. And he has been in this fight for decades. So if anyone knows where we stand right now with public health and how we need to move it forward, it's him.
Right.
Yeah. So we get to ask him straight up, what are the biggest threats to public health right now? How do we fight back against misinformation flooding our feeds? And what happens if policies keep heading in the wrong direction? We got to get real about public health.
I am so looking forward to this show, but until we get into it, we got to do the recap first. We got to let the peoples know what is happening in the world of health this week.
Dr. Mel, let's start off with the burning, itching, scratching, red bump question. What does the measles outbreak mean for you? There have been like 300 cases of measles this year across 15 states. We're already breaking records in just 3 months of 2025. What's going on?
Well, most of this year's cases were in people who were either unvaccinated or did not know their vaccination status. So we can start there.
So who, if anybody, should be worried?
You mean about getting measles? Well, I would say the good news is that most people have immunity to measles either through being immunized early in life or having previous infection. So if you were born before 1957, so the seniors in the crowd, you're generally considered to have natural immunity to measles because it was widespread before the vaccine was introduced. After 1957, most people got 2 vaccinations of MMR. So one of those M stands for measles. They were given to children. And basically, if that happened, you were considered fully immunized for life. So no additional vaccination needed.
One day I'll tell my vaccination story.
We have to.
We lost Li's audio, but she was saying we're gonna have to hear it because that's
right.
That's
one of these days.
Books. But I hear certain groups may need a dose or 2 of the vaccine.
Yeah, sort of like a level up. So there are certain high-risk groups who don't know their measles status. They fall into sort of 3 groups. So if you're a healthcare worker born before 1957 who doesn't have proof of immunity, you should consider getting vaccinated. That's number 1. Healthcare workers. Number 2, if you were born after 1957 and know you were not vaccinated, or you're not sure whether you were vaccinated or whether you're not sure if you had measles, you should get at least 1 MMR shot and get 2 MMR shots at least 28 days apart if you're high risk for exposure and you're in that group. So who are the high risk folks? College students, healthcare workers, international travelers, and women of childbearing age before they could become pregnant. And then the third group, the last group, if you were potentially immunized between 1963 and 1967, so my sort of late boomers, Gen Xers out there, and that was when the first measles vaccine was approved, there were some children who got sort of a version of that vaccine, so the inactivated vaccine, that was a little less effective than the live vaccine, which is used now. So if you know that you got that inactivated vaccine, or you're not sure, you should at least get 1 of the live MMR vaccines. And this is all according to the CDC. The way around all of this, there's a way around all of this. You can actually ask your medical provider to test you to see if you have immunity to measles. It's a simple blood test. Wow. So that you don't have to figure out whether you're in one of these groups or not. You know, if you're pretty sure, if you know for sure you got vaccinated, you don't need to worry about it. But if you're not sure, you fall into one of these groups I mentioned, you can always ask for that test.
Oh, that's good to know.
Yeah.
That's good to know.
Hopefully that was as clear as mud. But the bottom line is you can get tested if you're not sure.
Yeah.
All right. Moving on to number 2. Give blood and you shall receive health. What do we mean here, Dr. Mel?
So there was a study that suggested that people who give blood regularly are more likely to have genetic changes in their blood that could cut the risk of developing cancer. So when you donate blood, you have cells in your bone marrow. They're called stem cells. And these stem cells make new blood cells to replace the blood that you donated. So then
we hear, I'm sorry, I'm jumping in, Dr. Mel, because we hear so much about stem cell research. So what exactly does it do again?
Yep. So these stem cells, consider them sort of the cells that then turn into all the different kinds of cells you have in your body. A hair cell, a heart cell, a pancreas cell, a blood cell. So you have stem cells in your bones that their only job is to make more blood cells, all the different kinds of blood cells that you have. So when you give blood, that blood needs to be replaced. Your body automatically knows, hey, wait a minute, I need to replace. So let me ramp up production. So what happens is stem cells naturally develop change when they age. which increases the risk of diseases such as cancer developing. But they see that of the people that donate blood, 50% of them versus only 30% of the people who infrequently donate blood have changes in their stem cells, which were protective against developing leukemia, which is a certain kind of blood cancer. So in other words, if you give blood, you're more likely to have stem cells that are healthy and don't turn into cancer cells later, is the bottom line. There's a lot of more work that needs to be done to research this, but I think it's reassuring for those people that do give blood frequently that you might actually be getting more than you give. So just a shout out to the blood donors out there.
Okay. All right. And moving right along here, it's time to tap that. Time to tap into your tap water is what we're saying here.
Correct.
There you have it.
There's been a lot of stories in the news about plastics in the body, and so, Dr. Mill, is that something we should be concerned about?
Well, it's turning out that it is something we probably need to be concerned about. A recent study found that the human brain contains about a spoonful worth of plastics. That's not normal. And they found that people in their study who were diagnosed with dementia had up to 10 times more of these little microplastic particles present in their brain as compared to those people who did not have dementia. They also found that the amount of these microplastics has been increasing over time. So as they studied more and more brains, they saw a 50% increase in the brain of plastics in the brain samples collected over the last 8 years compared to the ones collected before 8 years ago. Which, if you kind of think about the last 8 years, people have really upped their drinking of bottled water and potentially other sources of exposure to microplastics.
Wow.
We can't do nothing no more.
I was just gonna say that, Wayne. It's always something, huh?
Well, if you think about it,
drink a bottle of water.
If you think about it, what I have always tried to avoid doing is leaving my plastic bottle in the hot car, because then the plastics are gonna melt into the water and leach into the water. But you don't know what happened to that bottle of water before it got to you, right? Just getting to you. Probably it heated up and cooled down and heated up multiple times. So
they store them on a truck.
You're right, exactly. So researchers really believe that changing from bottled water to tap water might be a way to reduce the intake of microplastics, decrease the intake at least tenfold. So at least the researchers in the study are really suggesting that people switch back to filtered tap water versus bottled water.
Dr. Mill, I have up my hand. My hand. I know I'm interrupting the show. I know I'm blocking the flow of the show. What if you live in Flint? You going to drink that tap water? What if you live in Jackson, Mississippi? Those are public health crises.
They are. And I think that there are filtered, water filters that can help to address that, which is why I said drink filtered water, tap water, as opposed to bottled water.
I'm going to stop talking.
Yeah. All right.
Because it is time for
the weekly debunk. Stopping misinformation in its tracks.
This text I got from Bernice Bamalam. Bernice Bamalam says, doctors don't have a cure for autism, but I heard that bleach enemas can cure autistic kids for sure.
I don't know about that. Excuse me, Dr. Mel, is that true?
Well, it is true that there is not a cure for autism. It is not true that you need to use bleach enemas or any other detox means to quote unquote detox from autism. Unfortunately, we're seeing groups, private, online chat groups with over 27,000 members, moms of children with autism, that, these myths are circulating in these groups. And they include things from using ingredients that are used in bleach, like chlorine dioxide, to things like turpentine, to using the child's own urine, to do enemas or give them these things by mouth. There is really no credible scientific evidence or research supporting any of these claims. And it can be harmful. That's the thing. Parents have reported, doing this and are, trying one of these detox cures and have seen that their kids develop severe skin problems, diarrhea, increased irritability, you name it. So, sometimes you see things in the comments that say, well, these kinds of adverse reactions are just proof that the detox is working. Again, not true. And it can do serious harm to the child. So we do know that autism affects 1 in 59 children. It's a developmental issue that many parents and professionals really just view as a different way of being, as opposed to a disease that needs to be cured. So don't take advice from these groups. Talk to your doctor. These things can seriously harm your child and actually might even be considered child abuse.
Vet your doctor and talk to your doctor, because the person at the helm of the health care in this country. Okay. All right. We'll see y'all in a little bit.
I just want to say we'll see y'all in a little bit.
On that note, thank you all very much. We'll see you all back very shortly because we're going to jump into the show. We're diving into the biggest public health challenges that our nation is facing in 2025 and beyond, from threats to healthcare access and vaccine policy shifts to climate impacts and the future of pandemic preparedness. We are going to cover it all. There is a lot of stake. There's a lot at stake. And it's especially true for vulnerable communities. So with the new policies that are taking shape in this administration, alongside growing influences of figures like Robert F. Kennedy Jr. and Dr. Mehmet Oz, the public health landscape is shifting, and it's shifting fast. So to help us break it all down, we are honored to have one of the nation's top public health leaders with us. His name is Dr. Georges Benjamin. He is the executive director of the American Public Health Association. He spent decades at the forefront of public health policy, advocating for evidence-based solutions to keep us as Americans healthy. So we're going to get his expert insights today. And Dr. Benjamin, thank you for being here and welcome to the show.
Dr. Mel, thank you very much for having me. It's good to see you.
Good to see you too. So let's jump right into it. So public health is really kind of at a critical crossroads this year. What do you see as the biggest threats to public health that might be keeping you up at night?
The biggest concern that I have right now is the lack of principled quality leadership at the national level. We've got extraordinary people at the state and local level in most cases. But right now, I'm very worried about the national leadership. We've seen over the last several weeks the amount of misinformation and disinformation that's been articulated by our current health secretary. The fact that they're not using the experts that they really have in the Department of Health and Human Services to engage with the public and to give us good information. So right now, that is my biggest concern, is the lack of leadership and the amount of bad information that's out there. That's not evidence-based, it's not science-based.
Well, thank you for breaking that down. We're about 2 months into this new administration's policies. How would you describe the direction that public health is headed in under President Trump's leadership?
Yeah, so far as the word is chaos, dysfunctional chaos. And it's not just that, we worked with the Trump administration in the last time President Trump was in order. I tell you, there were lots of adults in the room. Somehow those adults that are not there. And, bad things are happening. And again, misinformation. I'll give you something that just came across the wires today, where Elon Musk said has died because of the cuts at USAID. USAID is the nation's international organization. And people are starving, diseases are out there, and he doesn't have that evidence, that nothing's bad has happened. But things like that, Hazel's case that we're having in this country is a big problem.
Yeah. And if you're not a public health expert, you don't understand the gravity of the situation, the risks around the corner of defunding agencies like USAID or the CDC. And so I perfectly hear you. You mentioned the Secretary of HHS, but now we're actually seeing Dr. Mehmet Oz, who's in confirmation hearings to serve as the head of the Centers for Medicare and Medicaid Services, which oversees Medicaid, which is, many low-income and disabled Americans, pregnant women get their insurance through Medicaid. They also oversee Medicare, primarily seniors. And then they also oversee the Affordable Care Act, also known as Obamacare, which is primarily helping self-employed as well as low-income working Americans. So together, these programs provide health insurance for roughly half of the United States population. So let's start off with the Affordable Care Act. What's happening with the Affordable Care Act under the current administration? What are some of the threats that you think we need to be aware of?
Well, the current administration has done several things. Number one, they've already reduced funding for the outreach workers that have been working to get people into the program. So that's the first thing, trying to get people actually covered and insured. Secondly, they are planning to dramatically cut the program for the subsidies for the health exchanges. That's private insurance that people get where the federal government is subsidizing the coverage that people get so that your premiums are affordable. So they do that, they will raise the cost of premiums. There's a great deal of discussion right now about advocating for more what we call skinny plans. So when the administration was there before, they promoted these slimmed down plans and people were buying them because they were more affordable. But then when they got to go, when they really got sick, they found that it didn't really cover anything useful. So that they were not something that you really want to spend your money for. And so that's
so just to pause on that, it's like buying homeowners insurance and then finding, when your roof blows off, it doesn't cover it, or So same thing with health insurance. When you actually need to go use it, even though you're not paying a lot for it, when you need to go use it, it doesn't really do what you need it to do, which is pay your premium, pay your bills, and your medical expenses.
That's right. And sometimes for things that are everyday things, maybe because you need to have your hip surgery done, or you fell and broke your arm. There are limits to a lot of those plans. There are high deductibles, meaning you have to put out of your pocket a lot of money before the insurance kicks in. So I encourage people, if you're going to make that choice to buy one of those skinny plans, do your homework before you get them.
So don't do it. And the other thing too is you mentioned subsidies. I have to say, over the summer I was talking to a gentleman somehow at the gas pump, and we were talking about that very same thing about cutting subsidies to those folks who wanted to enroll in the health exchange plans, and he didn't know what the word subsidy meant. So can you break that down for us a little bit more?
Yeah, it means that the federal government pays a portion of what you normally would have paid. So when you buy health insurance, you can pay anywhere from $30 to $300 or $400 on average for a monthly premium. You pay that out of pocket to have the insurance, and that's your premium. And so the federal government pays a large portion of that for the exchanges for people who are middle income people. so that is much more affordable. So maybe instead of paying $200 a month for a policy, you only have to pay $50 a month. So it's much more affordable. And the federal government is paying, that part for you. And the problem is that we increase those subsidies, those additional payments on behalf of the people of America during the COVID pandemic in order to make sure we got everybody covered. And those subsidies, those additional payments, they run out at the end of this fiscal year and they have to be reauthorized. And right now, the Congress, particularly the House on the Republican side, has put up a budget that may not allow us to actually have the dollars to do that.
Right. Let's move on to Medicaid rather. So that's folks, the Affordable Care Act, the health insurance exchanges, middle income people who don't get insurance through their jobs, right? Self-employed folks. Now let's move on to Medicaid, which I mentioned covers pregnant women, disabled individuals, low-income individuals. What are some of the challenges that we're seeing to Medicaid under this current administration?
So Medicaid is the nation's insurance program. So the way to think about this is if you're very low income, Medicaid covers you, and the federal government covers that insurance program. And it's a partnership between you and the state. The states pay a portion of the cost and the federal government pay a portion of the cost. And then the health exchanges that we were just talking about are mid-income individuals to people who are have a much higher salary. And then if you are a senior, age 65 or older, then you're eligible for Medicare, no matter what. And what the federal government is doing, primarily the Congress, when they passed this most recent budget, they didn't put enough money in that budget to cover all the costs for Medicare and Medicaid. In fact, they're trying to get about $800 billion over 10 years out of the Medicaid program. So what that basically means, the way you can take that money out is provide less services for people, to put out less money per beneficiary. In other words, pay your doctors and your hospitals less money, or somehow otherwise cap the amount of money going out the door. And at the end of the day, every time they've done that, less people have been covered. Now, under the Affordable Care Act, when we put the Affordable Care Act in place, Obamacare, almost all the states increased eligibility for this Medicaid program so that nobody low income would not be covered, except for 10 states, mostly in the South, mostly the states that have the worst health outcomes. For one reason or another, they said they did not want to cover their citizens. So they still have Medicaid, but the eligibility for that program is so very low that in many cases it's laughable. And now they want to take more money out of the program nationally because that's the only way they can find savings. And I understand being fiscally responsible, but what the public needs to know is that they want to take the money away from lower income individuals and give it to rich people in the form of a tax cut.
Yes,
exactly. It's for a tax cut.
So it's take from the poor and give to the rich. So just talk to us a little bit about what does it mean if people are not going to be able to afford insurance on the health insurance exchanges because the portion that the federal government pays for is going away, cutting Medicaid, therefore, potentially fewer people are going to be eligible for Medicaid. What is that going to mean in terms of people's health and their ability to access health care?
Well, it means that they will have inadequate money to provide care for those folks. And if you're in middle America, in a rural community, the likelihood that your hospital will close because they won't have the money to pay for services is increased. A lot of our rural hospitals, the margin that they live on is those Medicaid dollars. And so that means that a lot of those hospitals will close. Now, You know, the interesting thing is that a lot of these folks think that the folks that are getting these benefits look like me. But they're all folks. They're folks, African American, they're white, Latinos, they're lower income white Americans in rural America, they're farmers who are benefiting. They're military people. We have military folks whose families are so low income that they may very well need these coverage if they don't have access to a military hospital in their community that has the services. So some of them are on Medicaid. Some of them are on food stamps. We have military members on food stamps, and they want to cut all those dollars.
And people will get sicker. They'll possibly die earlier or end up in the hospital, be disabled, have strokes, have heart attacks, etc., because they're not getting the preventive care because they don't have access to care. So,
and here's the dirty little secret: they don't save the money. Because what happens is people show up when they get really sick. They show up later for care. That care costs them more money. Then they have poor health outcomes, and they often die sooner.
Yeah. So help us understand the term health equity, and is this administration trying to stop that work from being done?
You know, there is a group of individuals who have now adopted a racist, and I use that word with intention, philosophy to demonize diversity, equity, and inclusion, and to redefine it from what it says. So diversity, equity, and inclusion means exactly what it sounds like. We're going to make sure everybody's involved. That's inclusion. We're going to make sure people get what they need in order to achieve optimum health and well-being. And we're going to make sure that we have a diverse group of people that receive these services or get the help, because we know that diversity results in better outcomes in the workplace, in programming, and delivery of services, and for healthcare, a big deal. And we know during COVID, we had significant communities of lower income individuals, regardless of race, regardless of gender, who did worse during the COVID pandemic, because it took a while for people to basically put out the resources that they needed to provide that care. Remember when we were testing people and only people who had money or had a card could get there, could get tested? Remember when we were taking care of people in the hospital, but the people that were showing up really sick were lower income individuals or minorities, or people who had to go to work every day? The well-to-do people work every day. They could stay at home in front of their computer. But if you were
or the hospitals in the poor or in the rural areas had worse outcomes than the hospitals in the urban and more resourced hospitals, because they had the equipment to help keep people alive. Right.
That's absolutely correct. That's absolutely correct. And we also had so much misinformation that people weren't wearing masks. They were avoiding getting vaccinated from COVID. They weren't taking medications. We had people that were telling people to use officials, public officials, giving people bad information. And what we saw from that was certain parts of the country where their ideology was such that they were opposed to good public health practice. They had higher number of people who got sick, higher number of people who died from COVID, regardless of, again, their views of the world. It's really a problem.
It is. So you've talked about what health equity is. Do you think that this administration is trying to stop this work from happening?
Oh, this administration has done everything they can to stop this work from happening. The president signed an executive order, which, by the way, fortunately, right now has been stopped with a temporary restraining order, to not fund any of the DEI programs. They are going after research institutions, academic centers who have programs. They have the nerve to tell folks that we can't spend our money to help people of color improve their lot in life. They're telling people how to spend their own money, foundation programs, that they can't do that. And of course, we've seen this story before. We saw this during Reconstruction after the Civil War. We saw these efforts to erase us before. So we know this drill. And they can tell you that, no, they're just trying to make sure that they treat everybody equitably. And that's not what they're doing. We've heard that rhetoric before. We know this story, and we will not be fooled.
Yes. So thank you for breaking that down for us. I know that we've mentioned sort of vaccines and the vaccine information. What impact do you think that Robert F. Kennedy Jr., who's been a vocal critic of vaccines, what impact has his influence had on public health efforts? And are we seeing changes in vaccine uptake, do you think, as a result of that, of his influence?
Well, he's been in office for a few weeks now, and he's already been the biggest purveyor of misinformation that I've seen in many, many, many years. He has certainly, he says he wants people to get vaccinated, but he's done everything he can to impede that. He's created misinformation about the efficacy of vaccines. He's talked about the fact that if you are healthy, you will not die from measles. That's not true. If you're unvaccinated, your risk of dying from measles is very high, much higher than would be if you were vaccinated. But that's a better way to put it. And he has stated that there are holistic ways of reducing your ability to get sick and die, even though you're unvaccinated with the measles vaccine. So, for example, he's told people that if you take vitamin A, or if you're healthy, you won't get measles, and if you do get it, you won't get real sick. And that's just not true. There is a role for using vitamin A in people who are vitamin A deficient, who are real sick, but it won't stop you from getting measles. The only thing that prevents you from getting measles reliably is being vaccinated.
We, as you heard earlier in the show, we do a weekly debunk, and that was our weekly debunk last week, that taking vitamin A does not prevent you from getting measles, just as you said. I want to, move on to the fact that the U.S. has stepped back from certain global health initiatives under this administration. We're seeing this measles outbreak, which, definitely has not gotten to the level of an epidemic or a pandemic. But how does this stepping back from global health initiatives affect our ability as a country to combat future pandemics or disease threats that come from outside this country?
People often ask, how does our reaching out to other countries and spending money in other countries and helping them with, if they perceive their problems, help me in the hood with my problem? And the truth of the matter is that it's better to provide those services to other countries, to your neighbors, to other, folks in Africa, folks in the Southern Hemisphere, through the Agency for International Development, because if you can treat those diseases there, then those diseases which are only one plane ride away from us won't get here. The other thing, of course, is the humane thing to do. And so we, as a ethical, caring nation, should be trying to help other people. And we can do this in a much more affordable way because it's easier to treat these diseases where they originate than having those diseases come here. Remember when Ebola came to the United States several years ago, and what a real big issue that was. We did have some deaths in our country. Not many. We were fortunate because we had a very robust public health system that picked up on it early. But we also had people overseas that were keeping it from coming here. And we have lots of viruses. I mean, COVID is another example of a virus that, came from outside the United States and came here. And quite frankly, had we not had some forward-leaning engagement with the World Health Organization, despite the argument we often have with China, if we have not been working collaboratively with those countries, it would have been worse here.
Right. And we already know millions of people died from COVID. So, well, I can't believe that it's already time to start taking questions and comments from the audience. I still had a bunch more questions, but I want to make sure that we get them in. So Lila and Wayne, come on back. Let us know what's going on in the chat and in the audience, what you're seeing out there.
So much. I I always have my own questions, but let's go to the chat. So with what's happening in the administration, a lot of people are just not trusting the CDC and WHO anymore. Is there a way to develop more trust with those organizations? How do we do that? How do we get people to lean in to good information coming from those organizations?
So I understand that the administration, people have lost some trust in federal authorities. And I still trust the Center for Disease Control and Prevention. They're still the best knowledge experts in the world on most things, as well as the World Health Organization. I think that the Secretary Kennedy aside, who have big issues with it, as you've heard, most of those federal officials are still getting up every day, working hard to give us good information. But look, one of the things that we now have that we didn't have when I was growing up is that we have Dr. Google.
Yes.
So that means you can go to other trusted sources to validate what you hear from federal sources. So you can go to organizations like mine, American Public Health Association. That's www.apha.org. You can go to American Academy of Pediatrics. You can go to the American Medical Association's website. I tell people to go to authoritative sources that been around for a long time, and these folks get up every day wanting to make sure you're healthy. So the professional associations, I believe you can still trust.
Okay.
Then validate what you may see from the federal government and crosswalk that with those organizations. So far, the information coming out of the Center for Disease Control and Prevention is accurate. Now, there may be a time when, like at the end of the last Trump administration, where the politicals got a hold of the communications apparatuses, and they started changing things. That yet happened. Well, let me make an exception of that. They did try to change gender and get rid of anything that said gay or transgender, but there are groups that went to the courts, and the court said put it back. So they had to put the information back. So at least right now, as best we can tell, and they have hundreds of data sources and websites, but as best we can tell, they put it all back. Now, we will tell you, organizations like mine, we're going to be quite vocal if we discover that they're tampering with that information and not giving the right information. So when Mr. Kennedy has said things that we thought were inaccurate, we have spoken. And so I think there'll be other organizations that are doing the same thing.
Dr. Benjamin, is there a newsletter coming out of your organization that folks can sign up for?
That's a good question. The best thing to do is go to our website. We are a membership association, so members can join us. Can join APHA as a member. I'm not hocking memberships on your site today.
Well, I asked the question. So please answer.
But almost a lot of on our website is free. We give a lot of free information on our website. We have free webinars. Most of the stuff is not behind the paywall. And a lot of our health information is not. And we link to groups that we think are authoritative sources. So we do link to the federal government. We do link to other professional associations on our website. And Have we ever made a mistake? You bet. Nobody's
Sure.
perfect. But as soon as we find out, we fix it and we correct it and we let people know that this is the right information.
Okay.
Wow. So let's go to the question. One of the questions we had with all the all these challenges, what can everyday Americans do to protect their health and push for policies that truly benefit public well-being?
Yeah, I think that you should become as informed as you can, and then talk to your elected officials. Local elected officials at your state level, at your county level. Hold them accountable. Go to town hall meetings. Ask them to answer the questions that you have. Write your questions down that you don't know the answers to, and go to them and say, "Tell me what give me the answers to these questions." Demand that they answer those questions. Now, right now, I think that the public, because right now they're on recess and they're back in the hood, and so you should go to their offices. You should call them on the phone. You should do your homework and write a letter and give them your views. I just encourage you to make sure that the answers that you have are things you truly believe. I'm not going to tell you what to believe, but I am going to tell you do your homework and then share with them, because they work for us.
Right.
They work for us, and
Right.
we need to be accountable. And by the way, in my organization, we go up on the Hill all the time and we talk to them, and they hear us. They know exactly what I'm going to say when I walk in the door. I'm going to tell them all the health things that I think and what I think are the best way to do things. But you're a constituent. When you go in there, they got to listen. Okay? Because they don't listen to you when it comes time to elect again. You have the right to make a different choice. And they know
that's right.
There we go.
That's right. Dr. Benjamin, what are 2 questions we could ask? Now, listen, I'm calling and I'm writing about all the things, but what are 2 health-related questions that we should be demanding answers from our folks?
The 2 things that I would demand right now is, number 1, I would demand they tell you whether or not they're going to support the Medicaid program, and they're going to resist any cuts to the Medicaid program. That's the first thing I encourage you folks to do. And the second thing I would do is tell them, do they believe in climate change, and what are they going to do to address climate change in our community?
Ooh.
Climate change is here, is impacting our health today. That's why we have such superstorms, big rainstorms, tornadoes, hurricanes, heat waves. And we still have people that say climate change doesn't exist.
Isn't real, right?
Right.
It's real.
In the last administration, they didn't acknowledge it.
Oh, no,
not in the Biden administration. I'm talking about.
You talk about the last Trump administration.
Right.
The last administration wasn't supportive, and these guys are on steroids, not supporting it.
Right.
Yeah.
They take away all the climate funding. They've look. Let me give you an example. You talked earlier about Flint and lead in the water. The IRA, that bill that was passed by President Biden, has money in it to replace the lead lines in our community so that we won't get poisoned by lead in our drinking water. Guess what they want to cut? They want to take away that money. Who's going to poison?
Right. And those environmental rollbacks are differentially affecting communities of color, because communities of color automatically have been, sort of segregated, if you will, to certain communities like Flint, where there's lead in the water, and have more environmental pollution, sort of thinking of Cancer Alley in Louisiana. So, a lot of communities of color are situated in places where they're going to have worse health outcomes because of environmental conditions, and the rollbacks that are happening are specifically going to affect them and make their health even worse.
And we used to have offices, the Environmental Protection Agency, that did environmental justice. Guess what? They didn't like the word environment, and they didn't like the word justice. And they put those offices.
Yeah.
And they were making sure communities were not disproportionately impacted. And by the way, these were not all minority communities. These were also lower income white communities, because
right.
there are poor folks in those communities than they are in our urban settings. It really being poisoned by these things.
Yeah.
And they closed them because they didn't like the word environment and they didn't like the word justice.
So we have a question from Yvonne Smith. She says the CDC and the HHS websites are not communicating with us. The loss of employees at HHS and CDC, how will that affect us?
Yeah. So imagine you showed up for your work one day, wherever you work, and your boss said, because we've only hired you for the last 6 months, we're going to let you go. And you've been doing stellar work. You got these evaluations that said you walk on water, and then they give you a sheet of paper saying we're firing you for unsatisfactory performance. How would you feel?
Yeah.
That's what they just did to these federal workers. All the probation employees, all the people that have only been on the job for a short period of time. And one of the quirks in the federal government is that if you move to a different job, a promotion, you also go into a probationary period.
Right.
Okay.
So all those people.
Fire them. And so again, court order made them bring those people back. But they've told these folks, I don't care where you were during COVID, you moved out of state, you got to show back up to work. By the way, they gave these people 24, 48 hours to move back across the country. And they're looking to do a mass firing of folks. And you've seen this seesaw stuff where they're don't know who they fired, and so they're having to bring them back because they're firing the wrong people. I don't know if there are any of the right people to fire, but they're people, air traffic controllers, security, people that manage our weapons. In CDC, they tried to fire the EIS officers. Let me tell you who they are. They're called the Epidemiology Intelligence Service. They're the expert disease detectives. It was like firing a class of Navy SEALs. These are the experts in disease detectives going through school at CDC. They try to get rid of all of them. Can you believe that?
Which means that if we had another epidemic or pandemic knocking on our door, we wouldn't even know.
You wouldn't know. And what you may not know is that a lot of these folks, CDC gives 70% of its money out to local communities, helps fund half of the funds in most of your state and local health departments, okay? But they also give indirect support. So a lot of those people they were firing were working in the hood in our communities for our state. And guess what happens when those people go away? If you need to work, then your local taxes have to go up in order to pay for providing those services through your state and local government. So what they're doing is cutting the federal dollars, cost shifting to the locals, and then they're saying we're going to give you a tax cut. We're not going to give you a tax cut. They're going to give it to the rich people.
Right. And then local, in order to get the same level of service, local people are going to have to pay more taxes to the local and state government.
That's exactly right. These guys are scamming. Don't you know? And you would think that our nation would be above this, but we've let a bunch of shysters into the big house, and now we've got to deal with them, and that means we've got to make sure they follow the law. We've got to make sure it's transparent. We got to make it visible what we're doing, and got to hold them.
Yeah. So I do have a question. We've talked about a lot of challenges. Do you have, or is there anything that gives you hope for the future of public health?
I get to be the naysayer, but I also get to be the hopeful guy. Look, the American Public Association, we've been around for 150 plus years. We've been around since 1870. Wow. And we've seen real challenges, right? 1872 means that we were established shortly after the Civil War. and we have seen this nation grow. There isn't a health issue that has not been debated on the floor of our governing council, which is our governing body at the American Public Health Association. We debated the birth certificates, whether we should have birth certificates in our nation. We debated whether or not we should have clean air, clean water, those acts that were eventually passed by Congress. We debated the Affordable Care Act. We have every argument in health has been talked about and engaged at APHA. We're not going anywhere. We're looking for our next 150 years. And we have seen every game, political game, legislative game that anyone has ever tried to perpetuate on the American people. We've also worked collaboratively with people that we vigorously disagree with on things in which we can work together. So Mr. Kennedy says he wants to make sure that we have healthy foods for all of our kids. We're on board. But that means that we have to make sure that kids that are food insecure have access to food.
Right.
And then you see them in school. We got to make sure they have school lunches, and then it's nutrition. We got
without using the word equity. Right. We still got to do that.
No, we're going to use the word equity in doing that.
Yes.
We are not going to allow them to redefine diversity, equity, and inclusion, because the English language is a beautiful language, and we need to use every word, including racist. Okay. We need to make sure that we're using all the words in our vocabulary and call them as we see them. And I know people are afraid, but if you give them power, they will take it.
Yeah.
Only power they have is a power that we give them. They work for us.
Wow.
Well, on that note, I am hopeful having this conversation with you. I think we've heard some concrete things that we can do, concrete questions that we can ask around Medicaid, around climate change, around protecting vulnerable communities, that we can make sure that we are asking our Congress people and making them and keeping them accountable. We're looking forward to another successful 150 years for the American Public Health Association, but more importantly, the public health of our nation. So thank you, Dr. Georges Benjamin, for being here. We really appreciate you. Thank you, of course, Lala and Wayne. Y'all are incredible co-hosts. Thank you, my Be Health Empowered family, for tuning in. And until I see you, be wise, be well, and be health empowered. Thanks for tuning in.